Mississippi Born, Delta Raised is a podcast that focuses on the intersection of public health and social justice issues in the Mississippi Delta. Daphne Robinson, an attorney and public health professional, is your host. The first time I heard about the water crisis in Flint, Michigan was in public health school at Emory University in Atlanta. One of my classmates, Dr. Paula King, stood in front of our class and eloquently explained that 5 years ago this month, the city of Flint began using the corrosive Flint River as its main source of water, which ate away the city's lead pipes and leached lead into the drinking water of thousands of residents. 18 months later, the city reconnected to Detroit's clean water supply after studies confirmed what parents had been telling officials, that lead from their taps was poisoning their families. Since then, the state of Michigan has declared Flint's water safe to drink. Thousands of lead-tainted pipes have been replaced. More than a dozen officials connected to one of the worst public health disasters in U.S. history are now facing criminal charges. But for many residents, according to the latest issue of Time magazine, the crisis continues. Flint's families still stand in line for cases of bottled water. Parents are still fearful of lurking health problems, and many residents still refuse to trust what flows from their taps, no matter what the state says. Dr. Paula's presentation over 6 years ago to my class at Emory University made me start to think about the brown water that I drank in Greenville, Mississippi, and to question whether me or my peers had been harmed by the brown water that we had been drinking for years. In this episode of Mississippi Born, Delta Raised, I am here with Stephanie Showalter, the Executive Director of the National Sea Grant Law Center and the Mississippi-Alabama Sea Grant Legal Program at the University of Mississippi School of Law, to discuss the possibility of lead in water in the Mississippi Delta. Stephanie received a BA in History from Penn State University and a joint JD, Master's of Studies in Environmental Law from Vermont Law School. As the director, Stephanie oversees a variety of legal education, research, and outreach activities. Her duties also include the supervision of law student research and writing projects. Stephanie also teaches a foundational course on ocean and coastal law at the University of Mississippi School of Law. Please join me as I welcome Stephanie to this episode of Mississippi Born, Delta Raised.
Good morning, and thanks so much for inviting me today.
I'm so glad to have you here. What brought you to the state of Mississippi? I know that you're not a native Mississippian.
Yeah, so I was born and raised in Pennsylvania, but always interested in the oceans and loved whales. And so I thought that I was going to go to school and be a killer whale trainer at SeaWorld. So I started as a marine biologist, but then ended up transferring and deciding to go to law school to study environmental law. And so I got a law degree at Vermont Law School. And while I was finishing up a clerkship in Pennsylvania, I received an announcement that the National Sea Grant College program was starting a law center at the University of Mississippi. So I applied and was lucky enough to become their first staff attorney back in 2002. And I have been here in Mississippi ever since. So I moved to come and work in the state.
And you are currently the executive director of a project at the University of Mississippi's Law Center?
Correct. Yep. I'm the director of both the National Sea Grant Law Center and the Mississippi-Alabama Sea Grant Legal Program, which are legal research, education, and outreach services that serve both national and also in the state of Mississippi.
Tell me first a little bit about the center itself.
So we are a federally funded research center that our primary mission is to provide legal research and outreach services to coastal communities on a range of issues from development issues like sea level rise and flooding to fisheries and aquaculture, but also environmental health related to algal blooms and other water quality concerns. And so from that interest in water quality, we have been working with partners at the university to implement community-based research related to lead in drinking water in the Mississippi Delta. So we have been partnering with community organizations throughout the region to hold lead and drinking water awareness events and sampling opportunities for individuals to bring water samples to the university for testing. And then in addition to that, we do research on the current laws and policies in the state, and also demographic and housing data to identify where potential areas of concern might be.
You have been looking in the Delta about these issues, it's my understanding.
Correct. We started our work in partnership with the Tri-County Workforce Alliance that serves 5 counties in the Mississippi Delta. Most of the work initially was in Clarksdale, but we have now expanded and we've done events in Tunica, in Greenville, and many other communities in the region.
You and I recently participated in a function in the Mississippi Delta at the Hot Tamale Festival this past year, which I thought was a very successful event. And I know that your organization has also been doing studies of the water quality. Just want to know a little bit about what you all have discovered about the quality of water of some of the communities in the Delta.
Yeah, so what our preliminary research has revealed is that there are communities in Mississippi Delta that are experiencing elevated levels of lead in the water. It's important to note that lead in water is a very complicated issue because it's very dependent on the plumbing in the particular home or in the service lines that are coming to that house. And so you can have one house that has low levels of lead and the house next door could have high levels because they have different plumbing. And the testing that is required by federal and state law is very minimal, especially when public water systems don't serve that many customers. So one of the unique aspects that we've discovered in our research with Mississippi is that water distribution for drinking water is very diffuse in Mississippi. So we have a lot of small rural water associations that may be serving 150, 200 customers. Because of the way that the laws are structured under the Safe Drinking Water Act, they may only have to test 5 homes every 3 years. So we don't have a lot of data about what the levels of lead are because there's just not that much testing. And so through our research, we've been able to provide that information to homeowners so that they can know what their levels are. To date, we've taken over 250 water samples throughout the 6 or 7 counties that we've been working with in the Delta. Thankfully, the vast majority have not had lead levels of concern. However, we have had 11 that are over 5 parts per billion, which is what the Food and Drug Administration uses for bottled water. And so we have provided those individuals with filters to help them reduce their exposure. One of the things that we've discovered is that well owners, so individuals who are on private wells, are more at risk because they're responsible for ensuring the safety or quality of their water. There is no requirement to test private well residences for lead. And so most times people don't know. So what we're trying to do is to just get more information out there and empower individuals and communities to take steps to reduce their exposure.
And it's interesting that you say that the issue is very place-based, because we know that public health is about place. The place really does matter. Where we live, where we work, where we play, those are issues that we call social determinants of health. And so do you see levels of lead in certain pockets of communities? What actions do you take to help those communities remediate the problem?
Right. Yes. So at one level, what you hear a lot about is, well, we should replace the lead service lines. And so that's what they're focusing on in cities like Flint, like trying to dig up the pipes and put new pipes in. But that's a very expensive intervention. And actually what we've been promoting is the use of filters. So you can buy filters at Walmart and other places that are certified to remove lead. And so that's one mechanism that's available to reduce your exposure. But you can also do things that don't cost any money, like flushing your faucets before filling your glass up to drink, and to not cook with hot water, because hot water can actually extract more lead out of the pipes than cold water. So there are some simple behavioral changes that families can make that can make a difference in exposure levels. The other thing that we recommend is that if there are infants in the home on formula, that they use filtered water or bottled water to make the formula.
And that's interesting, the point you make about not cooking with hot water. I didn't know that.
Yeah, I didn't know that either until we started working on the project. And who doesn't use hot water to fill up their pasta pot so it doesn't
take exactly.
so long? Yeah.
To make it boil faster, or at least That's what we think.
Yes.
If the problem is concentrated in certain neighborhoods, certain blocks, certain communities, how are you getting the word out to those communities?
Yeah, so we are trying to work in partnership with existing community organizations to kind of be our liaison or voice in the community. So we have worked with churches to hold events on, Wednesday evenings before Bible study. So the members of the church can get information and have their water tested. But we've also worked with organizations that do programming for middle school and high school students that are interested in health careers. So we provide them, the students, with information that they can then share that with their families and neighbors and friends. And now that we've got some preliminary data and we're starting to be able to do some mapping, we're hoping that we can reach out to community organizations that are working in the areas that we're trying to target, so that they could then help us identify the best mechanism for getting the information out.
Are there any specific communities that you feel comfortable with discussing?
Within each county, one thing that's very unique about Mississippi that we've learned through this project is that the drinking water distribution system is very distributed, meaning that there are many public water suppliers in counties. It's not uncommon for a Mississippi county to have 15 to 20 public water systems. And so we have a unique culture in Mississippi of rural water systems that were designed to help people get off of private wells and move into a public system. But because of the low population in many of the counties, we just have a lot of rural water systems serving small numbers of customers. And that can just create challenges for maintaining your infrastructure when you don't have a lot of people that are, paying into the system. So most counties unfortunately we'll have like one public water system that may be having trouble with lead levels. And so, for instance, in Washington County, the city of Leland has currently a lead level they're reporting of 10 parts per billion. I want to be very clear that that level is in compliance with federal and state law. The limit that public water systems have to take action at is 15 parts per billion. So the city of Leland is in compliance with state and federal law. However, from a public health standpoint, no exposure to lead is considered safe, and a home that might have that type of level with an infant drinking formula, that's a lot of lead that might be exposed to that infant. And so we want to try to get the word out that in some of these communities that are experiencing elevated levels of lead, but not above the federal and state action level, people just might not know about that and might not know that they should be taking steps to reduce the exposure of their children.
And Leland is a town, that's not too far away from where I grew up in Washington County in Greenville. And as I recall, when we were at the Tamale Festival, there were a number of people in Leland who came to the booth who questioned the quality of water in their community.
We did an event through a health center in Greenville where we collected samples. And in that event, we had about 20 samples, and we did receive one that was over 5 parts per billion. So again, it's under the federal Safe Drinking Water Act action level, but it's of concern to us if there's the possibility that there might be small children in the home.
And why is it that the heightened level of lead in water may be confined to it seems rather disparate, so why is it confined to disparate communities?
Oh, yeah. So because it's dependent on, so the lead is not in our source water. So it's not in the, kind of rivers or groundwater that we're drawing it from. The lead is coming from the pipes. And lead pipes were used in communities for decades, but some have been replaced. They were prohibited by federal law in 1986. So if you have a home that is built after, in the 90s, 2000s, there's less of a risk that you would have lead contamination because you have newer plumbing. But in older neighborhoods where there's older homes and older infrastructure that may not have been updated or repaired, that's where you can see the challenges. And so you can get some disparate impact just because it's somewhat tied to the age of housing and the ability of the public water system to maintain the pH of the water. And so the more acidic the water is, the more it is likely to corrode the lead pipes, and then lead can leach out. And so public water systems have to work to maintain the pH of the water. And in Mississippi, the source of most of our drinking water is groundwater, and the groundwater in Mississippi tends to have a lower pH than you may find in other regions of the country. And so that is just an added risk factor for Mississippi.
So if someone who happens to be listening that lives in the Mississippi Delta or knows individuals that live in the Mississippi Delta and may live in a rural community and in an older home, and they might have some concerns,
they should contact their public water supplier. So who their water bill goes to, if they're on a public water system, to ask for their most recent testing for lead. So by federal and state law, every customer of a public water system is to receive an annual report from the system. It's called a consumer confidence report. And that is either provided by mail or it may be online. And that's the first place that you can find information about your water system. But they may only test every 3 years, so you don't get as current information as you may like. Public water systems are regulated by the Mississippi Department of Health, and that is who does the testing. The water systems collect their water samples and send it to the Department of Health for testing. So you can also contact the Bureau of Public Water Supply in the Mississippi Department of Health if you have questions as well.
Well, Stephanie, we are so glad that you stopped by to give us this information about water quality in the Mississippi Delta. Is there a way that people can contact you at the National Sea Grant Law Center if they have questions or concerns?
Yes, the National Sea Grant Law Center has a project web page for this lead in drinking water. So if you Google National Sea Grant Law Center, lead in drinking water, that should bring you to our project page. And we are open to requests from community organizations to come and do lead awareness and sampling events in their communities. We have a small pot of money right now, but we are looking to other sources to try to increase that funding. So we would love to hear from organizations that might be interested in working with us on an event.
Thank you, Stephanie, for your time and the work that you're putting into improving quality of water and improving the Mississippi Delta generally.
Well, thank you so much for the opportunity to share our work.
I know there are thousands of podcasts, but you're here with me, and for that I say thank you. My name is Daphne Robinson, and I am Mississippi-born, Delta-raised.
This podcast is sponsored by the Center for Public Health and Justice. The Center for Public Health and Justice is a 501c3 nonprofit corporation. Its mission is to improve the public health and safety of communities in the Mississippi Delta. To learn more about our services, visit thecenterforpublichealthandjustice.org. This podcast has been a Deuce Vision production.